Hi there. We're back with our second part of our Calving Preparedness series, talking again with Dr. Roy Lewis, and now we're going to talk about some of the common incidents, problems, and issues you may come across during your calving process.
The million-dollar question on calving is always when to intervene when calving related, or you think there's going to be a calving related problem. And the biggest thing for that, the producers know their animals as good as any, in my opinion. They watch them fairly closely, and they usually know if an impending calving is starting. And really what you want to do is time it. If a cow is going into the first stages of labor and is starting to maybe have a little light contractions, looking for a place to lay down, what we're usually doing with cows is giving them about an hour to elicit some sort of progress, and with heifers probably an hour and a half. After that point, and when we see the water bag, then it's 15-20 minutes. We should be getting some sort of progress. Otherwise, it's time to intervene. And with producers that know their cattle, if something seems wrong, like if a cow has had a calf normally for 2-3 years, and all of a sudden seems to be delayed, probably it's a good idea to get her in and just check her out. There could be a malpresentation that would just delay that calf coming, and that will still give us enough time to hopefully get a live calf out of that cow. So that's really the time factors involved with impending calvings. The common mistakes that can be made with pulling a calf is probably rushing the cow. So we want to pull with the contractions of the cow. We want to use lots of lubricant. We want to take our time. We want to not panic. Those are probably the common things that happen. A lot of people also with the calf puller get to jerking it around. You want to go in nice, slow, even movements when you're using it as a little bit of a lever at times, and just not get too rough with it. It's a great piece of equipment, but it can put a whole bunch of force on the calf and the cow if we overdo it. So abusing it by jacking too hard or too fast is probably the common things we see in calving cows. Common procedures that you're going to have during calving time that either you can handle or require veterinary involvement. There's going to be a variation there. Would be the calf isn't coming out obviously, and you have to maybe it's a cow that's calved normally. Other years you want to check it out, and it's probably going to be a fetal malpresentation, so it's coming the wrong way, whether there's a foot back, a head back, it's coming breech, which is butt first or tail first. All these sorts of things can lead to that. Herniated intestines are a fairly rare thing, but they do happen, and we as veterinarians have been able to save some of them if the person sees it right away and flips the calf upside down. So the herniated intestines means that they've had a hernia, but it's broken open and there's intestines trying to come out onto the ground essentially. So if the producer sees that right away and flips that calf upside down and we get them into a veterinary clinic, some of them surgery can be done on, some of them we can't save, but it just depends. But that would be a dire emergency and one that we'd want to look at right away if there was an opportunity to work on it. So for allergic reactions, and we don't see many, but we can get allergic reactions to probably just about anything that's injected into cattle. Again, they're very rare, but the biggest thing that producers can do is to watch after they, let's say, give a calf its shots at a day of age, or give it an antibiotic in some cases, or even a vaccine in other cases. Allergic reactions can develop, and they usually involve heavy breathing. The eyes will be swollen, the face can get swollen, and the biggest thing to have on hand is epinephrine, and a lot of producers don't. Or they have old epinephrine, and even if they have old epinephrine, it's better to give that because you don't have time to run to the veterinary clinic or somewhere else to get that product. And that is one of the things to have in your little emergency kit, if you like, as a producer, not only just at calving time, but really any time that you're processing or vaccinating calves. During calving season, one of the most common infectious diseases that calves can get would be calf scour. So The good thing is there's scour vaccines available for the cows that will really help to minimize calf scours spreading through your herd. The other thing to do is try to keep the calving groups together. So a common number that's used if you have 200 cows is you may have the first 50 cows and 50 calves go into a pen, then the next 50 go into another pen. And what you're doing there is preventing spread of disease from one pen to the other by isolation, essentially. If we can eliminate, cases or isolate them when we first get the scours, isolate them to a different area and pull them out of the herd, that will prevent scours from spreading, and good nutrition and body condition score and all those other things that go to healthy cattle.
I'd just like to thank Dr. Roy Lewis for his time today in talking about calving emergencies and calving preparedness. Again, my name is Shane Menzak, and I'm part of the 5-person livestock production team based throughout Alberta. If you need to get a hold of us, we can be reached through your local UFA.